Now, in the IT, this is the more challenging one, and this is what I'm very excited about. What we do is, the patient comes in, we decide to put the patient in, patient pays in advance, and then the patient gets admitted. From here on, we do rounds, we order labs. From there, this one goes to the pharmacy. Medicines are sent up to the IP, to the beds. Finally, when the patients are ready for discharge, the bill gets generated and they go home. Just in real life, how this happens is, I'll share this with you. This is our IP billing, so we send the patient up to the second floor where they get admitted and the advance is taken and so forth. And this is how the blood allotment takes place, the AC rooms, non-AC rooms, wards, etc., ICU, all that. This is our ward round. The entire floors are Wi-Fi, so we have a kind of a card where we have a laptop on it, and we move this with us room to room. And the physician assistant, one of us actually key the ward notes in. This is how the screen in front of us will look when we do a round. We do like morning rounds, evening rounds, we have a diagnosis, so on and so forth. And we order blood tests also right then and there, and this is picked up by the lab. Radiology also is where we get our reports all on the system, ultrasound, echo, EMG, all these things come on the system. Discharge summary is like 2 minutes for us. We decide to discharge the patient, and it's just a click of a few buttons. Our discharge summary is like, the reason being, the diagnosis goes from the OP, and when we put the patient in, it automatically gets transferred to the IP. And then when the discharge summary is made, it automatically gets transferred to the discharge summary as well. So it's just a click of a few buttons and we have our discharge summary which is ready. And the discharge bill also which gets generated by a push of a few buttons. Because everything comes and collates at one point and then we open the bill up. And the amazing thing about this system is that, for example, the other day we were doing a patient enrichment program for some bariatric surgery patients that we did. And so we wanted to call some potential patients also. So we just went back to the last 3 months and said, how many of our patients had a BMI over 30? And there it comes. Just it pops up in your screen, you just do it with a push of a few buttons. How many of my patients had diabetic retinopathy in the last 1 month? There it comes, and you can generate even the list of patients who actually have it. And we use it a lot, and we plan to use it more in the times to come because we have about with all the patients already in the last 1 year, so we'd like to analyze the data. We do only diabetes, thyroid, and endocrinology. So we'd like to know more about what's going on with our patients. So it's very easy to work on.
Are you outsourcing diagnostic services?
Absolutely not. We will not outsource anything because all these things
are diagnostic services.
It's so very critical to us, diagnostic especially, because you must remember we are people that treat only diabetes, thyroid, and endocrine disorders. So what is very critical to us is our lab. Even diagnostics means laboratory diagnostics.
So what do you suggest for such a clinic?
I would say you should never. This is one thing my professor some years ago he told me that these things are so critical to the hospital that you should never, because you want to have that much of quality on these things. I know that we are digressing from the talk, but yet to answer your question, I personally my suggestion would be never outsource critical things like this, because you have absolutely no control over these things once you let me go. Is what I suggest, but I heard
part of the treatment.
It is. So it's very outsourced. Let's see, for example,
what will happen for such a hospital where MR or any other complicated procedures are not available?
Oh, that way. Okay. Yeah, of course. I mean, in that setting, you probably have to go with the vendor who you think is the best. I mean, when you have to set a patient for an MRI, you don't have facility. Obviously, you have to outsource, isn't it? Yeah, obviously. But what we would also look at is the pedigree of this acute center. I mean, do they match our value system? Do they do all that? That's what I suppose we would want to know. Isn't it? I'm sure anybody. I wouldn't like to say, it belongs to all of us who work there.
IP said that you register.
No, it all goes into the system. It's all
with the writing back.
No.
Only laptop.
We have a physician assistant who comes with us, who puts it in, who keys it in. Or one of us doctors, I mean, most of us are quite okay with putting data in.
Is it legally acceptable, sir?
Yeah, see, basically, this whole question to my mind is that when something like this comes out, what would the court want to know? Can somebody tamper with this data? Right? The thing is, in the way Joby and Co have decided is that within 7 days, the system locks. Nobody, even they can't, do anything. So, if somebody from the court of law comes and they want to see if anybody can tamper with it, even if the best brains come, they can't tamper with it. So, this is how the discussion will be. For example, we do phase 3, phase 2 trials for various countries. And they insist that this is how things are and stuff like that. And even they have moved on to an EMR-based system, suggesting that that's the way forward. And even what they want to know is, when they come, they try to go back and see if data can be manipulated. And it will be very obvious to them, as it's obvious to anybody else, that you can't touch that data. So once that is proved, I think any court of law, anything, will not really, because all this is a very dodgy issue, it's very easy kind of a thing. Anybody can argue back and forth. But I personally feel that what is the big deal in having like big tons of paper which you can't make head or tail of, most of it degenerating. Nobody can even, after 2-3 years, you can't even read what is going on there. Versus something that's crystal clear which will stand out for this thing and then you can't tamper with it. I suppose any judge, any code of law would make sense out of it all. But the thing is, whether it's legally binding versus, I think this is basically in the realm of some odd incident. But even if that should incident arise, I'm sure I'll be able to, personally, I'll be able to back up. I can stand up in a code of law and I can back up my decision. It's completely easy, but what we do is when the patient goes, we generate the thing and send it along with them. So that's for them. We don't want it. We have it in our. See, the whole point is that if you maintain a hard copy, I'll give you a simple logic. The moment you maintain hard copies, me as a doctor, I will speak for doctor. He get dependent on the thing. So you're always more happier looking at it, where you can feel it some form. So my personal fear is that the moment you introduce paper, that's it. 30% of his rights. If NABH can actually endorse. Yeah, see that's something that I personally may not be able to take that question because I only deal with thyroid endocrinology. This sort of thing we need to really max it versus for example trauma and things like that, which we're not too familiar with. I mean, it's not that I don't know what it involves or anything. But again, that's one thing. But personally speaking, I don't think it should be a deterrent because what we do is, for example, consents. We have 2 theaters, we have like an ICU. What's that? The thumb, acknowledgement or this consent. Yeah, we're thinking of moving towards that line because NABH wants all the patients even the ones who want to get trained in OP to get a general. So, I mean, to my mind, that's like really far-flung, but still, if that's the mandate, we have to do. So we are thinking of going for a biometric this one to get a consent, stating that they are okay with everything that they do on the and so forth. Then comes consent for particular procedures. So all this, I can see where the problem really is. If you want to scan it, it can be scanned. You know, you just have to deploy some scanners and educate the team, your team. And that can be done all this happens in no time at all.